Hello and welcome. Come on in. I'm here. Welcome to Medical Revolution in Progress. And let's get behind the scenes today. The subject is something everyone's heard of, everyone fears. I think the most feared thing in the world is speaking in public, and the second most feared thing in the world is a diagnosis of herpes. So I thought I'd talk about that and share some of my experiences over the years with this virus that's been around forever. We'll get into the testing, how to test, what tests are worth having, when to get tested for herpes, what it means. We'll talk about the different types of herpes, HSV1, which is typically oral, and HSV2, which is the dreaded genital herpes. So I thought I'd start off with a couple of short stories about some patients I've had over the years and how testing when you don't need to or testing when it's done improperly can cause people a whole lot of heartache, a whole lot of shame, a whole lot of guilt, and it's all really quite unnecessary. I remember when I was working in the clinic, I had a young girl who was in a new monogamous relationship. She had never, I should say young woman, she had never had, sexual intercourse before, and she and her boyfriend had been going out for quite some time, and she finally decided this would be the guy, I guess. So she came in to see me. She had very itchy, burning vaginal area. She was in incredible pain. She had felt feverish the past couple of days. And this is another interesting thing. Whenever younger adults come in, and this could be older adults too, but typically it's younger, they won't mention that there's something going on in the genital region. They'll describe a lower belly pain, or just generalized symptoms like body aches, fatigue, fever, but they won't. I've had it happen where they won't specifically state that they have some rash or something on their genitals. You would think that would be the first thing out of people's mouths when they come in, but surprisingly, no. So that's where it's very important as a clinician that you ask those questions. And if you don't find a reason with the regular exam, like an abdominal exam, that you ask the patient, would it be okay if we do a genital exam? Because many times people avoid doing it to begin with because it's uncomfortable. As a clinician, it's not really uncomfortable, not at all, but it's still uncomfortable for the patient sometimes, and especially people who are very modest. It can be a deal, so you have to be careful. So this young girl did present that way. She came in actually with her mother, even though she was 18. She came in with her mother and was complaining of lower abdominal pain and just sort of all these vague symptoms like fatigue and fever. She didn't know what's going on. So I asked her mother to step out of the room, and I asked her some other questions like burning with urination, any vaginal discharge, is she sexually active, those kind of things, and just prodded her a little further to see what was going on. And she said, I'm not sure, I might have something down there. So that was where I felt like, great, we have to take a look. So when I took a look, she had pretty much classic herpes. We call them lesions. It sounds much worse than it is, but basically she had a herpetic rash. And herpetic rashes are very much like, if you've had chickenpox or shingles, which I'll get into a little bit later, but they're basically like little tiny fluid-filled blisters, and they come in little clusters. They look really, they just, when you see them, like this isn't good type thing, and they're not, because even though you can treat them symptomatically, if you have a herpes virus, as everyone's heard the adage, herpes is forever. So, and it can be very traumatizing to be diagnosed. Regardless, I don't ever completely give that diagnosis until I test, and we'll talk more about that in a second. So, did an exam, I saw these things, and then that's when I found out she had recently been sexually active with this boyfriend, the only boyfriend she's ever had. So this was clearly traumatizing for two reasons. One, the the potential diagnosis of herpes, and two, the boy that she was with, the young man that she was with, gave this to her, and this was her first, and it was supposedly his first. And so now she's wondering, can I trust this person? What's going on? So what I did was I took a culture, which is the best way, honestly. If you have active blisters, lesions from herpes, within 2 to 3 days, if the person comes in, and typically they will because they're in a lot of pain, especially for their first episode, you want to do a culture. And at the clinic or hospital or wherever you are, they have these special viral culture kits, and it's really just like this little tiny Q-tip, and you find a lesion that's sort of open already and leaking some fluid, and you get some of that and you put it in the tube and you send it off. And they do what's called a PCR, which is a polymerase chain reactive test to check for the virus. And if you have, like I said, lesions that are new within a couple of days, and there's enough fluid that's coming out, or you could even, I've popped them before, but it's not a good idea. You can spread it worse. So I've only done that once or twice, but you just take a sterile needle and just sort of pop the blister very gently, obviously. So you send it out. Then what I told her was, this is presenting as if it's herpes. However, I'm not going to tell you that's what it is until the culture comes back, because sometimes you can be surprised, and that's kind of what happened here. So she was distraught, and she asked me, does this mean, that my partner was with someone else? And I said, well, he could have had this before he's with you. No, he's never been with anyone else either. So either way, there's something there now that she's concerned about in terms of trust. And so I said, let's wait until we get the lab back. And so then sent that off. I put her on Valtrex, which is a medicine that people have probably seen advertised, but it does make the symptoms go away more quickly and clear up the lesions. When the test came back, the viral culture came back, it was HSV1. And HSV1 is not genital herpes. But wait a second, she had it on her genitals, right? Well, that's where the confusion can come in. And it actually was much better for her because it was HSV1. She spoke with her boyfriend about it, and he had cold sores in the past. That's what HSV1 is. When you have a quote cold sore, that's herpes type 1. And yes, when you have oral sex, you can transmit, especially if it's an active lesion or it's still spreading or shedding. You could give this to someone on their genitals, and that's in fact what happened. So this was actually more good news for her, even though she ultimately had a diagnosis of HSV or herpes. It was type 1, it was oral, it was from her partner, he hadn't lied to her, the trust wasn't broken. In addition, when you have HSV1 herpes that manifests in the genital region, it tends to be a lot less likely to recur, and if it does recur, then it's much less painful and short-lived. So all around, even though she had this diagnosis, it ultimately ended up not being quite as bad as if I saw her, didn't send out the culture, just told her she had herpes too, didn't bother to verify it, and just told her, well, just deal with the fallout of your relationship. This is something huge to me, and this is something I think any clinician should really consider doing when you have these situations with herpes. It's not just a matter of treating the patient's symptom or disease or illness. It's their whole world that you need to take all of that into account. If I hadn't done that, or if someone else had seen her and not done that, I hate to think of what would have happened for her. She could have had trust issues the rest of her life. It's just a lot of trauma that is unnecessary. So that's the first story. I have another story of a young woman. She was in her 30s who had come in, and she asked for the full STD panel. This is something that's very common, where a patient will come in and they'll ask, they want everything checked. Either they're getting into a new relationship, they're contemplating a new relationship, they suspect or know someone cheated on them. There's lots of different reasons for this, but it's a common request. And, when you do these, quote, like all the STD checks, okay, you're going to check the serum, which is, the blood, and you're going to do an HIV test. You're going to do a syphilis. You're going to do a hepatitis C. You could do a hepatitis B, although it's pretty much eradicated at this point. And then you ask them if they have any symptoms. And symptoms meaning burning with urination, man or woman, or discharge, vaginal discharge, penile discharge. If they have those symptoms, then you want to take a look at the genital area and examine it for any lesions or anything like that. Women are very notorious for having chlamydia and not having any symptoms. So either way, I would end up screening a woman for, and the men for gonorrhea and chlamydia. Most men are going to have symptoms though. So you can do a urine. It's not the most reliable, but if there's no active evidence of an infection, it's just a good way to sort of alleviate any concerns. If a woman's coming in for a pap smear, you could go ahead and do the culture as well. Men, I don't do cultures. That's incredibly painful for a man, and I think it's really pretty much inhumane unless you have to. You don't want to do a urethral culture on a man. Sticking a Q-tip into a man's penis is very painful. So it's really not something that you typically do, especially when it's just like a routine screening and they're not symptomatic. Everyone always asks me, well, are you going to check for herpes? And this is where my big, I guess, point of contention is, or pet peeve, when providers say, oh, sure, we'll do a blood test for herpes. Never, ever do a blood test for herpes if you don't have any symptoms of herpes or you've never had symptoms of herpes. If you suspect that you are with someone who has herpes, that's more of a discussion to have, and you discuss it, but you don't want to just randomly do an antibody test for herpes. The fallout from this can be so traumatic for a patient and can be lifelong. And if you don't take that into consideration, I think it's so unethical to the point where it could be malpractice, honestly. I had this young woman come in, and I said, well, no, I wouldn't do a herpes test unless you have active blisters there or you suspect you've had it in the past because you've had painful blisters in the vaginal area. And so then she burst out crying and said, well, I was told I have herpes. I had a routine screen for STDs last year, and the test came back positive for herpes, but I've never had an outbreak. However, because that test came back positive, I ended up not having a relationship with a man I was involved in that time because I was truthful and I told him my results and he broke up with me. This is the kind of story that breaks my heart, and the pain in this woman's face and the shame she felt was completely unnecessary. Number one, if she had gone to a clinician who knows you don't test if someone is asymptomatic, she would have never had the test to begin with. But that part's done and over with. She was tested and it was positive. There was still some saving grace for her, however, only in the sense that, well, do you know which test they did? What antibodies were positive? Well, I asked her more information and she said no, she didn't have the information. She didn't know. So I told her there's a 2-part blood test that I'll typically do. If someone is highly concerned, they don't have any symptoms, but it's possible. And so first you do what's called a herpes select ELISA. It's a specific type of test, and you can check for, again, type 1, which is oral, type 2, which is genital, but they can go back and forth. It does happen because people have oral sex. And so once you get this test back, if it's positive, there's still a secondary test you can get, because there are such things as false positives. And this is why you don't want to do the test unless you truly believe the person has it. So I said, and if that test comes back positive, we'll still do a secondary test. The secondary test is a test that was available in my lab, and it's quite accurate, and its sensitivity is 99%, meaning if you have it 99% of the time, it will pick it up, and there isn't a false negative. That specificity is very low. And so the second test that you can do as a follow-up or confirmatory test is a herpes simplex type 2 inhibition assay. And these are done if someone has a weak positive, or you just want to be 100% sure. You can rule out any false positives with this. And so we did the first test. I explained all this to her, and we did the first test. And the first test that I did came back negative for herpes. Her blood test didn't even show herpes, the one that I did. So when I told her this, she, this was in a follow-up visit, like a week or 2 later, she burst into tears. She was not only very happy and relieved, but she had been carrying around all of this shame and this diagnosis of herpes in her mind. And anytime she didn't even try to get into a relationship the past year, because she was so afraid that if she did start to like someone, then she'd have to tell them this diagnosis, and then they would reject her as well. So you can see how it's not funny, but it's so frustrating, because you can see how if someone is not careful with the way that they order tests or the way that they talk to patients about this, you can traumatize this patient, okay, and their loved ones. And so here's another story. I had a father put into my schedule towards the end of the day. He was frantic because of a positive herpes test. And so he comes in, and the guy is freaking out, totally freaking out, and just distraught. And he says to me, I came in because I called up the nurse, and she told me that I tested positive for herpes, and I'm just really upset, and my wife is pregnant, and now she thinks she has to have a C-section, and I'm really worried, and I don't know if my wife is even going to stay with me. I mean, this guy says this all within like 30 seconds of me saying hello. He just like totally lets loose, The guy was a nervous wreck. So I said, okay, let's take a breath, and let me look into this. Already I'm starting to feel irritated, not at him at all. I'm irritated because I'm suspicious that I'm going to find something that tells me this guy doesn't have herpes. So I, before I even look in his chart, I just asked him, why did you have this blood test? And he said his wife is pregnant, and she had STD checks, and they were all fine. And I said, does she have herpes? And he said, no. But her, she was told by a friend, if you have herpes, you have to have a C-section, which is kind of true if you have active lesions, and that's something you discuss with the gynecologist. Regardless, the woman was a nervous wreck. She made him get the testing for everything. He had an HSV1 and HSV2 ELISA test done, and he had no symptoms. Never had a cold sore, never had blisters on his penis, never had an STD, like nothing. Currently asymptomatic. His test came back positive for antibodies to HSV1, which is oral herpes, which are cold sores. Okay. I think something like 70% of the population has antibodies to HSV1. This is why you don't. It's just not a good idea.